So at this point, I'm going to introduce Rena Brewer, and I need my glasses to do that. Rena will be presenting David Flannery's presentation as well as her own. Thank you, Rena, for taking that on. Rena is the director of the Southeast Telehealth Resource Center and the National School of Applied Telehealth at the Georgia Partnership in Telehealth, and has lots of experience with developing telehealth systems. Thank you for coming.
You're going to keep me on track to get us to the break timely. All right, Dr. David Flannery, I know him very well. He is on the board of Georgia Partnership for Telehealth, so I see him quite frequently, and it's a pleasure to work with him. And I guess I need to do this. No. Right arrow. I made it disappear. Well, that's what Dr. Flannery gets for leaving. All right. All right. He was supposed to give an update of his work and the Georgia Partnership for Telehealth, so I certainly can do that. And this is what the state of Georgia looks like in terms of telehealth services. So every one of these little markings represents a place that either provides telemedicine services or receives telemedicine. And Georgia Partnership is known for clinical telemedicine. We do some other telehealth services like distance learnings and administrative meetings, but mostly what we do is clinical telemedicine. Oh, remind me, it's on the right? Okay. Georgia looks good, but let me tell you, there's a whole lot of room to grow because there's many counties that do not have patient presenting sites, and the public health departments are looking, in fact, they have already started to equip their county departments with equipment. So eventually, we hope that every county will have a patient presenting site, which will be incredible. Another area that we have grown in is school-based telemedicine. And right now we have, I think it's 18 schools equipped. But think how many schools, and every county's got multiple schools. So hopefully, over time, you won't even be able to see the counties. There'll be so many presenting sites there. Georgia Partnership started in 2004 as Georgia Telemedicine. We were part of Blue Cross Blue Shield. It was a grant that was awarded to the state of Georgia through Blue Cross Blue Shield and WellPoint and Anthem. I came on board with them in 2006, so I originally was a Blue Cross Blue Shield employee. After the 3-year commitment, there was a little bit of money left, so then we were able in 2007 to transition into a nonprofit, which is the Georgia Partnership for Telehealth. And I can tell you, it's when we became that nonprofit that it's like the floodgates opened, and we were able to greatly expand services. Another positive thing that blessed Georgia was that it was the insurance commissioner who was behind this initiative initially, and he was able to get reimbursement legislation. He worked with the legislators, and so in Georgia, it is required that a private payer has to pay for a telemedicine visit as though it were a live visit. And many states are doing that now. And Georgia is a good model for this. Down at the bottom, Dr. Flannery, speaking to his work, he does 3 separate half-day telegenics programs a month. And sees 4 to 6 patients per session. And he's the only one providing telegenetics in the state of Georgia. All right, the next project that he is working on is a pilot project he was telling me about over in Savannah. In fact, that was part of why he had to leave early. He has to be over there in the morning. And he's going to be doing a store and forward project with patients over there where they actually create a folder with digital images in it, and they will be these images stored in a folder. Then this electronic medical record will be forwarded to Dr. Flannery, and then he will respond to that record. Dermatology is very popular with store and forward, and as is wound care. And this is just what an image looks like. You can click on these images and enlarge them and write on them and do all kinds of things within this particular medical record, which is called Second Opinion. It's been out for a long time. With this particular project, they're going to collect data, and I'm going to have to read this because I don't know it. We'll collect data about number of store and forwards consults over the next year, testing recommendations as a result of the store and forward consult, how often the diagnosis is made, whether the patient ultimately needed to be seen in person, physician, patient, family satisfaction with the progress. So next year you should have this information. To tell of other work in the Southeast, Alabama Partnership for Telehealth is part of Georgia Partnership, but it is an Alabama company. It is a 501(c), and it is modeled after Georgia Partnership. So hopefully things will start happening as they really are over in Alabama. There are some hurdles over in Alabama that we don't have in Georgia, such as reimbursement and other things. Down at the bottom, there are 30 sites now in Alabama, and that's only been after a little over a year that we started working over there, which is pretty phenomenal, and considering they don't have reimbursement. So you'll find that even though there are barriers, telemedicine can happen, and it's only going to grow. And telemedicine life will get easier and easier as we move forward. And this is just a map of Alabama showing you the different sites there. We are doing stroke in Alabama, behavioral health, and I think some cardiology is going on over there. Lloyd Sermons is the director of the Alabama Telemedicine, and I have a card, my business card, and if you see me after this, I'll give you my card and you communicate with me and I can connect you with Lloyd or any of these other individuals that we'll talk about. There is a conference coming up. This will be the second annual conference in Alabama, Telehealth Conference, and it is in October. And I would certainly encourage you to come, and I can send you a save the date if you communicate with me via email. And it was well attended for a first conference. We had over 200 people there, and we hold it in Prattville right out of Montgomery. South Carolina is happening right now. I'll tell you in a minute when I get to the Resource Center, but we started a telehealth work group over in South Carolina, and much has happened out of that work group. The most significant thing is there's a 501(c) modeled after Georgia called Palmetto Care Connections. And I'm in Columbia usually monthly with this work group, and the executive director is Kathy Swarting. And I would love to introduce any of you folks from South Carolina to Kathy and help you know about the work that's going on up there. And I think they're going to move very rapidly as they move forward. This group was able to work with legislators to get some reimbursement legislation introduced, and the group hadn't even been formed more than 3 or 4 months. And that legislation last year didn't pass, but then there was some more legislation introduced this year, and some things passed, and then I think next year we'll see even more come out of South Carolina. And this is their website. And their annual summit. Last year we had the first summit. I worked with them on this, and so their summit is coming up October the 10th, and I would encourage any of you, South Carolina, North Carolina, anyone, to attend this. And we are excited that Dr. Bernard Harris is going to be the keynote speaker there. He's wonderful. Astronaut who's one of the original telemedicine folks, but he's excellent. All right, and here again, let me get you in touch with Kathy Swarting up in South Carolina. And then there is a 501(c) Florida partnership. A little bit of work's going on in the Tallahassee area, and the Resource Center is forming work groups. In fact, if any of you in Florida are interested in work groups, I've got them coming up next week. There's 3, one in Kissimmee, one in Miami, and one in Tallahassee. And it's the first meeting where we'll try to get people to start talking to each other, and it's a good thing. All right, and you can see he doesn't have any information about the other states. and he was going to jump in to introduce me as the Southeastern Telehealth Resource Center Director. This is a grant from OAT that was awarded to Georgia Partnership back in 2010, and we're so thankful and privileged to receive that grant and to become a resource center. So if you would scoot me over, Adrian, to the next